I think the basic advice for any general heart health is lifestyle change. And lifestyle has two components. One is balanced diet, and I think the also equally important is exercise. And of course, don't smoke if you are not a smoker, and to quit smoking if you are already a smoker. For the diet, I know it's easier said than done, but really what we aim to do is to reduce saturated fat intake, reduce added salt, reduce refined sugars, and really take a lot more of fiber, which is either vegetables or fruit, and perhaps meat and fish or some lean meat. I think these are very sensible things, and I think at the end of the day, it's everything in moderation. As for exercise, the recommendation is that you have to get certain amount of exercise 3 times a week. But I think for most people, it's not something easy to do. What I would suggest is just to try to get any activity as much as possible. Even walking, climbing stairs, brisk walking, or even a short burst of 10-minute exercise a day is still better than no exercise at all. So I think that's the first step that we can do to make to improve our cardiovascular health, which is a lifestyle change. Of course, subsequently, other things that we can do is to screen ourselves for the risk factors for heart disease, which actually are diabetes, high blood pressure, and cholesterol. So they can be screened easily with blood tests. Blood pressure is actually very simple to do, and now with many automated machines, one can actually easily check his or her own blood pressure. The recommendation for screening starts at around 40 years old. If you look at the cholesterol guidelines, the first test recommended if the patient had no previous history will be about 40 years old. And if the test is normal or a good cholesterol result, then subsequent one will be at between 3 to 5 years. But if the results are borderline or not so good, then the next test will be actually in 1 year's time. And that of course depends if the first test was abnormal, is very high result, then perhaps we have to consider starting therapy for these patients to reduce the risk of heart disease years later on.